Hi everyone, welcome back to my channel CodeMed Mastery. In today's video, let us see some important questions from compliance and regulatory. In the CPC exam, there will be 3 questions from this section. Let's start. Before that, don't forget to hit the like button, share this video and subscribe to my channel. This is the first question. Under HIPAA, what would be a policy requirement for minimum necessary? Option A, only individuals whose job requires it may have access to protected health information. Option B, only the patient has access to his or her own protected health information. Option C, only the treating provider has access to protected health information. Option D, anyone within the provider's office can have access to protected health information. The correct answer is Option A. As a policy requirement, only those individuals whose job requires it may have access to protected health information. Next question. Which statement describes a medically necessary service? Option A, performing a procedure or service based on cost to eliminate wasteful services. Option B, using the least radical service or procedure that allows for effective treatment of the patient's complaint or condition. Option C, using the closest facility to perform a service or procedure. Option D, using the appropriate course of treatment to fit within the patient's lifestyle. So the correct answer is option B. Medical necessity is using the least radical service that allows for effective treatment of the patient's complaint or condition. Next question. What describes whether specific medical terms, services, treatments, procedures, or technologies are considered medically necessary under Medicare? Option A, National Coverage Determinations Manual. Option B, Internet Only Manual. Option C, Medicare Severity Diagnosis Related Groups, that is MS, DRG. And option D, Medicare Physician Fee Schedule. The correct answer is Option A, National Coverage Determinations Manual. This manual outlines whether specific medical terms, services, procedures or technologies are considered reasonable and necessary under Medicare. It's a key resource used by providers and Medicare contractors to determine what is covered nationwide. Next question. Under the privacy rule, the minimum necessary standard does not apply to what type of disclosures? Option A, uses or disclosures to drug companies. Option B, disclosures to or requests by family members. Option C, disclosures to the individual who is the subject of the information. Option D, uses or disclosures to insurance companies. So what is the correct answer? The correct answer is disclosures to the individual who is the subject of the information. That is option C. Under HIPAA privacy rule, the minimum necessary standard does not apply when a patient requests access to their own protected health information. Individuals have the right to access their health records and covered entities must provide the full information requested, not just a limited portion. The other options, drug companies, family members and insurance companies, are generally subject to the minimum necessary rule unless another exception applies. So the right answer for this question is option C. Next question. Which of the following choices is not a benefit of an active compliance plan? Option A, eliminates risk of an audit. Option B, fewer billing mistakes. Option C, increases accuracy of provider documentation. Option D, faster, more accurate payment of claims. The right answer is option A, eliminates risk of an audit. While an active compliance plan can reduce the likelihood of an audit by providing proper billing and documentation practices, it cannot eliminate the risk entirely. So, the right answer is option A. Option A is not a benefit of an active compliance plan. So, that's it for today. Thanks for watching. I will see you in the next video.